Hey everyone, welcome back to the clinicaltrialsguru.com. I am Dan. I'm joined by Darshan Kulkarni. He is an attorney who focuses on clinical trials. He focuses so heavily too on clinical trials. Do you do any other kind of law, Darshan?
I do primarily life sciences law.
Oh, okay.
So I do advertising for pharmaceutical companies and life sciences companies and medical device companies. I do contracts for them and their providers, things like CROs, sites, advertising agencies. I work with medical communications companies and the like. So
Oh, okay.
really around the life sciences area, I see myself as the guy who helps you primarily from the point of the IND all the way through.
Oh, okay. So much more than just clinical trials. But regardless, he has a wealth of information. We're
Right.
going to be talking. We just wrapped up a video on clinicaltrials.gov for patients and how people who want to join studies can use clinicaltrials.gov because there's a lot of people out there who don't know anything about clinicaltrials.gov and they're interested in joining studies, and I think that's the first place you should go to besides the clinicaltrialsguru.com to find out about studies.
Right.
And so now it's for you research centers out there. Maybe you're a study coordinator, maybe you're a site director, maybe you're business development, whatever your role may be. Maybe you're assigned with bringing studies for your site. I know that could be overwhelming. I've been there before. But clinicaltrials.gov is again another great resource. If only we can get more pharma companies to register all their trials. Right, Darshan? Talk to us about that.
So the big issue with clinicaltrials.gov requires that every study that's not a phase one study and is in for the most part connected to the United States must be registered on clinicaltrials.gov. So any human study. So obviously we aren't talking about preclinical studies. It must be registered on clinicaltrials.gov. Unfortunately, there are some statistics out there that say that only 20 to 25% of studies are actually being registered. This is despite the fact that we're looking at fines of up to $10,000 per day if inappropriately registered or incompletely registered or inadequately registered. Um, so there has recently become, well, we're speculating here, but there has been a changeover in quote unquote ownership where the FDA is being made responsible for a lot of clinicaltrials.gov's functions. And Dan and I were talking and potentially speculating that a lot of that may have to do with enforcement. The NIH is not typically thought of as an enforcement agency. The FDA is typically thought of as an enforcement agency, and transfer of responsibilities may help with that enforcement function. Um, so there is an issue with enrollment. There's an issue of enrollment of the studies into clinicaltrials.gov, but it's getting better, and hopefully, with this new information out there, you'll actually get more and more studies being registered, which makes it easier for people in business development, um, in the CRO world, in the site world, to actually find potential studies. We should remember that CROs also often have to quote unquote pick up the pieces from other CROs. So this may also be a source for CROs to find work as well.
Hmm.
So if there's inappropriate or inadequate enrollment, a one sponsor may go, you know what, this CRO isn't working out for me. They didn't find the right sites for me. Maybe I can find another CRO
Mm-hmm.
that can do that. Or working with the right SMO or working with the right sites who are doing high enrollment. I'm probably going a little bit off topic here,
No,
but
no,
you'll
it's very good.
one of the things you see is sponsors using clinicaltrials.gov themselves for research on their own end. So what you can see is they'll start picking out sites now based on their enrollment numbers, because they will say, we've seen a site now that is doing the same type of work we want. Therefore, if we go to them and offer them X amount of money, maybe they'll work with us instead of the competing person. Or they might say, here are 10 studies that we want to get done. Our competitors using these 10 sites, maybe we can go to those same 10 sites. Or alternatively, if that competitor is enrolling right now, maybe I don't want to go to those sites.
Mm-hmm. Mm-hmm.
because those sites potentially have their hands full with the other competitor, and there may be worries about intellectual property sharing and worries like that.
Mm-hmm. Yeah, I think if you're someone in charge of getting studies, clinicaltrials.gov is the foundation for where you should be going, regardless of whether not all trials are being registered. A
Hmm.
great deal amount are. So if I want to get migraine studies,
Hmm.
hypothetically, I
Hmm.
type in migraine and hide studies that are not enrolling so that I can see, because you're not going to get a study that's closed to enrollment.
Right.
So from a business development perspective, you'll find all the studies going on with migraines. Now try to find out which ones you want and then click on it. You'll see the study. Sometimes you'll see the study director. Sometimes they'll have an email, but even if they don't have an email, it's very easy to guess sometimes just by looking at corporate email structures. It's very
Hmm.
easy to guess, like first name dot last name at whatever. Like that's usually the way it works.
Or first initial last name at whatever. So
Right.
like you just pointed out, it's usually a standard structure.
Yeah, so find out, email them, call them, do whatever it takes. You can even go more in depth with it. Sometimes, like Darshan was saying, the sponsors list the sites that are working on the trials. Sometimes they don't. Sometimes they put, like for instance, sometimes they list South Coast Clinical Trials as one of their sites, and some sponsors put a research clinic in Anaheim. So, and the reason they do this is because, at least they used to, and I don't know if they still do, they look at their sites as proprietary information. So they don't want a competitor, like Pfizer wouldn't want J&J
Mhm.
to find their best sites and start approaching them.
Right.
But many times you will see sites listed, like South Coast Clinical Trials, Breakthrough Clinical Trials, Resolve Research Solutions, whatever. If you are at a site and you can't find the study contact person, but you can find a couple site names on there,
Hmm.
call the sites. This is old fashioned business. Say, hey, I'm in charge of getting studies. I see you have this study. I probably have some studies you don't have. Do you want to share leads? They often will. I've done this before and I will do it again. So that's just some ways to get studies. Of course, there's many other ways. You can't beat good old fashioned networking. But when it comes to clinicaltrials.gov, you can get very creative if you want.
Hmm.
Anything else, Darshan, for the research sites out there when it comes to clinicaltrials.gov?
Um, well, one thing to remember is that a research site is often a resource for these companies, and what you might be able to even offer is negotiate with the if you are the primary site or you're a major site for them. Maybe you might be able to negotiate with the sponsor of the CRO and say, "We'll take on the responsibility of updating clinicaltrials.gov." It may be a potential source of revenue. I've never seen a site do that, but it's something to think about.
Mm-hmm.
The
Mm-hmm.
reason I haven't seen sites do that is because most sites don't have information from the other sites. But if it's a SMO that's pretty much controlling and the CRO and the sponsor don't want to take responsibility, this may be a way for you to make some extra money by updating clinicaltrials.gov, which is a responsibility the sponsor has. Or in some cases, depending on the type of site you are, the site itself has. Because if you are doing an investigator-initiated study, you might be the sponsor of that study by default.
Right.
So it's something to think about.
Very good. Hopefully, this helps you guys as far as your business development is concerned. And yeah, just check out clinicaltrials.gov. And if you have any questions, email myself or Darshan, and we'll have Darshan's contact info on this post.
Hmm.
This is Dan and Darshan from theclinicaltrialsguru.com. Thanks a lot.
Thank you.